My name is Roy Trawick. I'm an orthopedic surgeon at the Orthopedic Specialty Hospital in Murray, Utah. Usually it's not a matter of poor training. I mean, a lot of these sports are just high risk for certain injuries. Soccer, women's soccer particularly, women being particularly vulnerable to ACL injuries, for instance, and so we see a fair number of those coming out of those programs. And football, of course, is a violent sport by its nature. Good training can prevent certain types of overuse injuries, but you're going to see some traumatic injuries that are going to occur every season. Nowadays, the trend that we see more often, particularly with soccer and baseball, is these kids get into soccer and they're playing year-round. There is no rest. It's the same sport again and again and again. Same thing with baseball. It becomes a year-round process, and we're talking traveling for tournaments and things like that. So the way the sports are being played, and as a result, the level to which these kids are playing now is much greater than 20 years ago. And so we do have a tendency to see some injuries, which I think are related to the fact that their bodies aren't getting the proper amount of rest. And that's one of the things we've done here, I think, that's been very successful, is we incorporate that kind of thinking, that kind of training with the schools that we cover and with the Utah Youth Soccer Association, trying to pull those coaches in and educate them and educate their players in terms of how does you're feeding an engine. How do you feed that engine well so that you can maximize performance and minimize the chance of injury? And that's really one of those things that at the youth level has been relatively neglected in the past, and we're trying to pay more attention to it now to keep these kids out of trouble. We have great surgeons here. We have great physical therapists here, but it doesn't stop there. We have athletic trainers who are out at these schools rendering treatment and taking care of these kids on a daily basis in our high school programs. We have performance enhancement programs that are not replicated anywhere else in the state. And we only do one thing. I mean, that's the thing I've always said. We only do one thing, down to our surgical techs in the operating room. And when you do one thing, you tend to learn how to do it very well.